Okay, so this video here is going to be on action potentials, and it's by me, Haider Abdullah Sain, for Biopsychology 2S, PS 263 at Wilfrid Laurier University. So before we jump exactly into action potentials, it's important to focus on something called neurons. And the action potential mainly travels along this thing called an axon, where it has to have obviously enough energy or potential to initiate a stimulus, but we'll get into that later. So it travels along the axon to the axon terminal, causing chemical vesicles called neurotransmitters to be released, and so on, to stimulate other neurons, and thus cause a stimulus to be sensed by the body. And from this image, it's important to look at something called myelin sheets. And these myelin sheets allow for the action potential to travel faster along the axon. And these little things called nodes here just allow for jumps between the axons. Okay, this is going to be the main part of the video. And action potentials happen right here in axons, which are negatively charged. Inside is negatively charged at roughly negative 70 millivolts. The outside is positive due to a high concentration of sodium. Okay. Once a stimulus is sent, it has to be strong enough to reach negative 55 millivolts. If it's not strong enough to reach negative 5 millivolts, it fails to initiate an action potential, and thus no stimulus is sent through. So at negative 55, threshold is reached, and these things called sodium gated ion channels allow for sodium to travel inside the cell. And as sodium travels inside the cell, the resting membrane potential, which is at negative 70, increases all the way to this peak here. And note this process is called depolarization, indicated by the rising phase. And at plus 40 millivolts, these channels will end up closing. Okay, so what ends up happening at this point is potassium is inside the cell, and potassium gated ion channels open. Thus, potassium flows outside the cell now, causing repolarization, this falling phase right here. And it causes the axon to go beyond the resting membrane potential to this stage right here called hyperpolarization, where it's actually roughly at negative 90 millivolts now. So the cell wants to reach resting membrane potential so other signals can be sent along. So this thing called potassium sodium pumps 3 Na out and 2 potassium in. And that just causes this hyperpolarization of negative 90 millivolts to go back to resting membrane potential of negative 70 millivolts. And when this all happens, this whole process allows you to feel signals in the body. So if, for example, you were to touch something warm, the signal will travel across through these things called neurons all the way to your brain or your spinal cord, and thus you'd feel the signal and pull your arm away. What are some practical uses of action potentials? So one practical use is something called lidocaine, which is a topical anesthesia or anesthetic, which is applied on skin or areas on the skin that are affected to reduce pain of skin rashes, sunburns, poison ivy, or you might have experienced it during the tattoo removal process when uh, they use a laser which causes a lot of pain. But before they shoot the laser beams at you to remove the tattoo, they apply the topical anesthesia here seen in white to reduce the pain. And how does it work to reduce the pain? Well, it blocks sodium gated ion channels, and thus no action potential can be sent to the brain or the spinal cord, indicating that the body is in pain. And that right here concludes our video for action potentials. Hopefully you've learned some basics about action potentials and learned some practical uses that you can now take away in everyday life.